Thank you for joining us on our YouTube presentation on breast site-specific data items, SSDI, required in Missouri. My name is Jennifer Sedovic, and I am Education Coordinator at Missouri Central Cancer Registry, and will be presenting this topic today. I want to thank Babette Langeneckert for providing the slides for this presentation. We would like to thank our source of funding. The Missouri Cancer Registry and Research Center is supported in part by a cooperative agreement between the Centers for Disease Control and Prevention and the Missouri Department of Health and Senior Services, and a surveillance contract between DHSS and the University of Missouri. This is on SSDI manual page 13 and 15. Beginning in 2018, collaborative stage site-specific factors will be discontinued and replaced with site-specific data items, or SSDI. The SSDI manual is the primary resource for documentation and coding instructions for site-specific data items introduced in 2018. Unlike SSFs, field length is not limited to 3 digits, decimals are allowed, and different coding conventions are used to record actual values, percentages, and ranges. This is on SSDI manual page 13 and 15. An important new concept introduced in 2018 is the use of a schema ID to define the applicable SSDIs and the site-specific grade table for a particular tumor. SSDIs will have unique names and NACER data item numbers and can be applied to as many sites as needed. Site-specific data items, SSDIs, are driven by the schema ID. This is an SSDI manual, page 29, 34, and 35. Your abstracting software may even be designed to display only the SSDIs associated with the chosen schema. For example, the schema ID for a carcinoma of the breast is 00480. This value links to the Missouri site-specific data items associated with carcinoma of the breast: estrogen receptor summary, estrogen receptor total alloy score, progesterone receptor summary, progesterone total alloy score, and HER2 overall summary. Much like SSFs, the schema list and manual details are in alphabetical order and searchable. This is on SSDI manual pages 30 through 37. This table includes schema ID number, primary site, NACER data item number, and NACER data item name. Only 8 schemas require an MCR Missouri Cancer Registry site-specific data item, and just 1 through 5 items per schema. LDH pretreatment lab value is collected for melanoma of skin and plasma cell myeloma and plasma cell disorders. Fibrosis score is collected for liver and intrahepatic bile ducts. This is from a NACER SSDI webinar on 9/24/18. Timing on lab values. Lab values must be done prior to any treatment, including surgery, and should be done within 3 months of diagnosis. This is from SSDI manual page 168, 171, and NACER SSDI webinar from 9/24/18. Estrogen receptor positivity and progesterone receptor positivity are favorable prognostic factors in breast cancer, as well as endometrial carcinoma and meningioma. Positive results predict a favorable response to endocrine hormonal therapy. Combined ER and PR positivity is associated with increased response to anti-estrogen therapies. There are a variety of ways to report information on ER and PR results, but there is always almost a summary statement that the result is positive or negative. Estrogen receptor and progesterone receptor summary is a summary of results of the estrogen receptor assay and progesterone receptor assay. If single primary, positive always takes priority over negative or equivocal. Equivocal takes priority over negative. If multiple tumors show different ER/PR results, use the largest tumor for staging. For ER and PR positive, will take priority, even if it's from the smaller tumor. This is from SSDI manual page 171 and 177. Coding guidelines. Record the pathologist's interpretation of the assay value from the tumor specimen. Results from the ER or PR assay done prior to neoadjuvant therapy take priority. If there are no results prior to neoadjuvant treatment, code the results from the post-treatment specimen. Do not report the results of an ER/PR done as part of a multi-gene test, such as Oncotype DX, Mammoprint, or any other test that records HER2. Code 0 when the ER/PR is reported as negative or normal. Code 1 when the ER/PR is reported as positive or elevated. Code 7 when the ER or PR test was ordered but the results are not available. Code 9 when the ER/PR is reported as borderline, undetermined whether positive or negative, cannot be determined by the pathologist, example, inadequate specimen, or it is unknown whether the ER/PR test was performed, or the patient has only a clinical diagnosis of breast cancer, no tissue diagnosis. This is from SSDI manual page 171 through 172 and 177, and NACER SSDI webinar 9/24/18. Coding instructions and codes. Physician statement of ER, estrogen receptor, or PR, progesterone receptor summary status can be used to code this data item when no other information is available. The result of the ER/PR test performed on the primary breast tissue is to be recorded in this data item. Results from nodal or metastatic tissue may be used only when there is no evidence of a primary tumor. In cases where ER or PR is reported on more than one breast tumor specimen, record the highest value. If any sample is positive, record as positive. Exception is if ER or PR is positive on an in situ specimen and ER or PR is negative on all tested invasive specimens, then code ER or PR as negative, code 0. Invasive results take priority over in situ results. This is from SSDI manual page 171 through 172 and 177 through 179. If neoadjuvant therapy is given, record the assay from tumor specimens prior to neoadjuvant therapy. If neoadjuvant therapy is given and there are no ER or PR results from pre-treatment specimens, report the findings from post-treatment specimens. If the patient is ER or PR positive and no negative, a multi-gene test such as Oncotype DX may be performed, in which case another ER or PR test will be performed. The multi-gene test may include an ER or PR assessment, but do not record the results of ER or PR from the multi-gene test in this field. Record only the results of the test which made the patient eligible to be given the multi-gene test. This is from SSDI manual page 173, 179, and NACER SSDI webinar from 9/24/18. Estrogen receptor and progesterone receptor total allied score is based on the percentage of cells that stain positive by IHC for estrogen receptor or progesterone receptor and the intensity of that staining. Coding instructions and codes. Physician statement of ER or PR total allied score can be used to code this data item. Code this data item using the same report used to record your ER or PR summary. The allied system looks at what percentage of cells test positive for hormone receptors, along with how well the receptors show up after staining. This is called intensity. This information is then combined to score the sample on a scale from 0 to 8. The higher the score, the more receptors were found and the easier they were to see in the sample. If pathologist does not document allied score, registrar can calculate provided the percent positive and the intensity score are both available. This is from the SSDI manual, page 169, and these are SSDI webinar from 9/24 to 18. To calculate the allied score, you must have the proportion score, can be calculated based on percent positive, and intensity score. This must be provided by the pathologist. Example, patient's tumor is 72% positive for hormone receptors. Based on this table, 72% has a proportion score of 5. Intensity is strong, which is a score of 3. Your allied score is 8. 5 plus 3 equals 8. Another example is patient's tumor is ER/PR negative for hormone receptors. Percent positive coded as 000. Intensity score is none. Based on the table, proportion score is 0 for 0%. None has an intensity score of 0. So your allied score is 0. 0 plus 0 equals 0. This is from SSDI manual, page 173 and 179. And NACER SSDI webinar 9/24 to 18. Score 0 has no benefit from hormonal therapy. Score less than 6 does not respond to tamoxifen. Score less than 3 does not respond to letrozole. This is from SSDI manual, page 189. HER2 overall summary is a summary of results from HER2 testing. Record the pathologist's interpretation of the HER2 test from the tumor specimen. Results from the HER2 test done prior to neoadjuvant therapy take priority. If there are no results prior to neoadjuvant treatment, code the results from a post-treatment specimen. Do not report the results of a HER2 as part of a multi-gene test such as OncoDX or mammogram. If assays are performed on more than one specimen and any result is interpreted as positive, code as 1, positive, elevated. This is from SSDI manual, page 189. There's an exception. If results from both an in situ specimen and an invasive component are given, record the results from the invasive specimen, even if in situ is positive and the invasive specimen is negative. Code 0 when the HER2 is reported as negative or normal. Code 1 when the HER2 is reported as positive or elevated. Code 7 when the HER2 test was ordered but the results were not available. Code 9 when the HER2 is reported as borderline or undetermined whether positive or negative. Cannot be determined by the pathologist, for example, an inadequate specimen. It is unknown whether the HER2 test was performed. The patient has only a clinical diagnosis of breast cancer, no tissue diagnosis, or the tumor tissue is completely in situ. This is from SSDI manual, page 189 and 190. Precision statement of HER2 overall summary can be used to code this data item when no other information is available. The result of the HER2 test performed on the primary breast tissue is to be recorded in this data item. Results from nodal or metastatic tissue may be used only when there is no evidence of a primary tumor. In cases where HER2 is reported on more than one breast tumor specimen, record the highest value. If any sample is positive, record as positive. Exception: if HER2 is positive on an in situ specimen and HER2 is negative on all tested invasive specimens, code HER2 as negative, code 0. This is from SSDI manual, page 190. If neoadjuvant therapy is given, record the assay from tumor specimens prior to neoadjuvant therapy. If neoadjuvant therapy is given and there are no HER2 results from pre-treatment specimens, report the findings from post-treatment specimens. If the patient is HER2 positive and node negative, a multi-gene test such as Oncotype DX may be performed, in which case another HER2 test will be performed. Do not record the results of that test in this field. Record only the results of the test which made the patient eligible to be given the multi-gene test. Future plans for SSDIs. 2019, there's going to be no new SSDIs. Updates to notes and coding instructions for current SSDIs may be done as needed. For 2020, new SSDIs will be introduced. Information on these will be available in the later half of 2019. Codes and/or descriptions for current SSDIs will be updated and added as needed. These are the sources we use for this presentation. We use the Site-Specific Data Items Manual and NACER Site-Specific Data SSDIs webinar from 9/24/18. If you have any questions, please contact myself or the vet at the phone number listed on this slide. Thank you for attending our YouTube presentation. Have a wonderful day.